Schizophrenia causes more anxiety in the media and the public and even in doctors' offices than any other mental illness. Sufferers of schizophrenia have often been shunned or abused. The word schizophrenia literally means split mind, but contrary to popular belief, the condition has nothing to do with the split personality or multiple personality disorder. Instead, it is sometimes called a split from reality. This is known as dissociative identity disorder, which is a totally different type of dissociative disorder. This disorder is rooted in misconceptions and negative stigma due to lack of understanding in society. Schizophrenia includes emotional swings, nervousness, auditory and visual hallucinations, compulsions that come with mood anxiety disorders. It is a lot harder for those without direct experience to schizophrenia to understand the symptoms of schizophrenia and dissociation. A psychologist's job is to understand the things that can happen in the head of a schizophrenic. Understanding may be the key to compassion. For men, schizophrenia may arise in their early to mid-20s, whereas for women, in their late 20s. For some, the condition comes on gradually, however, for others, it could arrive more suddenly, perhaps triggered by stress or trauma. In the DSM-5, the schizophrenia spectrum disorders are currently thought of as characterized by disorganized thinking, emotions, and behaviors that are often incongruent with their situations. Successful treatment of schizophrenia depends upon a lifelong regimen of both drugs and psychosocial support therapies. Dissociative identity disorder. As mentioned before, schizophrenia and dissociative identity disorder can often be mistaken for each other, but they are not synonymous. According to the 6th edition of Abnormal Psychology, dissociative identity disorder is one of the most controversial and fascinating disorders recognized in clinical psychology and psychiatry. Dissociative identity disorder, formerly known as multiple personality disorder, is characterized by switching to alternate identities. Each identity can have an individual name, past life experiences, and characteristics. As defined by the American Psychological Association, this is a personality disorder marked by a disturbance in the integration of identity, memory, or consciousness. For example, a person may look spacey and then act completely different from just moments ago, in terms of talking, different voice, and a different life story. The personality changes, however, the body remains the same. These alters are all psychological responses to a very traumatic event. Some alters present themselves as the protector or helper, which functions an advisor to the other personalities or performs functions the host personality is unable to perform.
Depersonalization derealization disorder. This disorder is much like an out-of-body experience. A person will feel as if they are watching themselves from the outside, hence the name dissociative. They are dissociating from their own body. Other people and things around them may feel unreal, as if from a dream, and the world may appear surreal during the dissociation. Although the exact cause isn't very clear, it appears to be linked to an imbalance of certain brain chemicals called neurotransmitters, which can make from brain very vulnerable so that heightened states of stress and fear may lead to the disorder. This can be triggered by different stressors like relationship, financial, or work problems, a sudden death of a close friend or family member, severe traumas, or childhood traumas. Treatments often include psychotherapy.
Dissociative amnesia. Dissociative amnesia is a condition in which those afflicted cannot recall information about themselves or events and people in their lives. This disorder is not to be confused with organic amnesia. Organic amnesia means that it is caused by brain injury resulting from surgery, drugs, disease, or blows to the head. For our purposes, we are discussing psychogenic amnesia, which means it cannot be explained by a medical condition. This type of amnesia is generally believed to be an attempt to cope with a traumatic experience that the victim does not wish to remember, or is too painful to recall. Typically, victims with dissociative amnesia recover from their own amnesia spontaneously. People with dissociative amnesia or dissociative fugue may recover on their own over time. If not, some clinicians and psychotherapists are advocates for hypnosis. Psychotherapy is also used, which again involves helping patients recall and understand the trauma that contributed to their condition. This is so that remembering a traumatic event is not as painful and will not be repressed as it had used to be. Shown here are two brain scans. The left image is a normal brain, and the right image is one that suffers from post-traumatic stress disorder, or PTSD. PTSD can contribute to dissociative amnesia due to a traumatic past event. The goals of treatment for individuals with a diagnosis of PTSD include reducing the severity of the symptoms, preventing or treating trauma-related comorbid conditions that may present or emerge, improving adaptive functioning, and restoring a psychological sense of safety and trust, limiting the generalization of the danger experienced as a result of the traumatic situation, and protecting against relapse, according to Psychiatry Online. Suggestions to accomplish these goals are psychopharmacology, which is a mixture of psychotherapy and psychological medicine. Also, psychotherapeutic intervention immediately after the traumatic event transpires is crucial. Acute stress disorder. Acute stress disorder develops in an otherwise mentally healthy individual in response to an exceptionally traumatic event or time in his or her life. Acute stress disorder can often be linked to types of amnesia. No medical physiological condition can explain this disorder, though. Symptoms occur within 1 month of an individual's exposure to a said trauma. They may exhibit symptoms of depersonalization, derealization disorder, and oftentimes dissociative amnesia. The person will lose memory, oftentimes of his or her past or information about his or herself. For example, a person may be watching themselves in the mirror performing an action that they do not previously recall doing before, but has actually performed this action in the past several times. Medication, such as anti-anxiety meds, serotonin reuptake inhibitors, and antidepressants to reduce symptoms, along with cognitive behavioral therapy, are ways to care for and treat acute stress disorder. More generally speaking, dissociative disorders are conditions that involve disruptions or breakdowns of memory, awareness, identity, or perception. People with dissociative disorders use dissociation, a defense mechanism, pathologically and involuntarily. This means that they use dissociation in a way that is harmful to them, and they are using it subconsciously. Dissociative disorders are thought to primarily be caused by psychological trauma or an event in one's life or past that is too painful to recall.
People with dissociation often seek treatment for a variety of medical problems, including headaches, unexplained pains, and memory problems. Many people have symptoms that go undetected or simply untreated because they were unable to identify their problem or were not asked the right questions about their symptoms. Because dissociation symptoms are typically hidden, it is important to see a mental health professional who is familiar with your recent advances and the ability to diagnose dissociative disorders through the use of scientific testing and diagnostic tests.